You know, you would think that she would because she works here.
Right.
Oh, yeah.
Right.
But I don't know.
I almost forgot.
You almost forgot?
Last night, didn't go to bed till 1, and I was like, oh my god.
I have class in the morning.
Oh, I was excited.
So, fun fact, I was sleeping in until 7 on vacation. So when my alarm has been going off at 5:40 or 4:45, I'm like, and of course, all break, my daughter slept until 7:30. It was fantastic. The second I have to go back to work, she's like, 5:15? Yes, Mom.
When you have stuff to do.
Right, like, I'm not trying to get dressed too. So yeah, so welcome back. How was break for everybody? Nice, relaxing. I mean, tornadoes.
I was in the Dells for that.
You were in the Dells for that? Oh, nice. Yeah, so,
That was wild.
yeah, so that was obviously, Friday night we had tornadoes. And then this morning we had tornado-like weather again at 6 in the morning. And I was like, why? Are we just not allowed to have spring, Mother Nature? So yeah.
You guys got hit again this morning?
Yeah, we did. It was bad.
I slept through that.
Did you really? Oh gosh, not me.
Again, 5:45 or 4:45. I'm
Yeah.
not sleeping through anything anymore.
I had to drop my boyfriend off at work, so I was
In it?
caught in the middle.
Yeah.
I
So
dropped him off and it was still not raining, and I was on my way back. It started just pouring. I had to pull over. I was like, I'm not driving this.
it was so funny. So my husband had to be at work at 6, and he called me shortly after, and he was like, Corey. And I was like, what? He's like, I need you to bring me new pants. I was like, what? It's like, I need you to bring me new pants and new socks and a different pair of shoes. They're soaked, and I cannot wear these all day. And I was like, cool. At least it's on my way to drop the baby off. So,
You need
yeah.
to have a little bag in the car.
I was like,
extra work clothes.
I know. I was like, do we just need to start packing like a bag for you too?
Diaper bag.
Like, do you need a diaper bag too?
My boyfriend's a garbage man, so he gets stuff outside.
Oh no.
Yeah, but he's
So,
got
I
water.
I want to tell you a really funny story before we really get into today. My brother-in-law, God love him, told me once that he, growing up, wanted to be a garbage man because he thought they only worked 1 day a week.
Aww.
And I still, to this day,
that his garbage was picked
right,
up.
that one day he saw the garbage man, he's like, that is the job.
That's cute.
And I now think that is the greatest story, and I try to tell it as much as possible. Instead, he became a teacher. So, good morning. So.
You're dying. You're dying.
Yeah. Are you okay?
Maybe.
Amy went and passed.
Oh my gosh.
Yeah. And I just came back from Elgin today.
This is.
I'm sorry.
Okay, is Brenda here?
She's not. You can sit there today. What a crap way to start the quarter. My neighbor's very nice older man. I knew he was sick and he was in the nursing home, and his daughter called me yesterday and said that he passed yesterday too. And I was like, no. It's just a crap time.
Yeah.
So, well, on that fun and exciting note, welcome back. I gave you guys everything that you're going to need for today. I did go over like the syllabus yesterday in the live lecture, so if you haven't watched it or you didn't get to attend it, you'll kind of go over that. But the 6 of you, including you, Brenda, have an additional sheet that Carla does not. It's the one on top for externship. So what I want you to do is spend the next week thinking about where you really want to go for externship. Whether that's you tell me that it's a specific location, like I want to go to Mercy Pediatrics, or I want to go to Crusader Walk-In Clinic, or whatever that is. A specific place, perfectly fine. If you're like, I just want to work in a women's health, that's fine too, okay? I want you guys to really think about where you want to go, or what maybe department you want to be in, and list them out 1, 2, 3. Obviously, put the top choice that you guys want on number 1. 2 and 3, I will only use if I can't get you into number 1. Okay. The other thing is I need pre-externship resumes from you guys. I would hopefully be able to get that from you guys by week 3. So that way in week 4, I can start sending those out. Okay.
Is it just like a general resume then? Just like of our work experience?
Yeah, typically.
Okay.
Yep. If you've never written a resume or you need some help with it, make sure that you are using Hiration, that website that Rasmussen has, because it will actually give you the option to pick a template, and then all you have to do is type your information in, which is kind of a nice thing. So those are,
Is that on like the home screen of like?
yeah.
Okay.
Yep. If you can't find it, just reach out to me and I'll send you the
Okay.
link. Yep. So those couple of things, obviously I wanted to hit very first for you guys. Sorry, you don't get this yet. You're like, that's okay, Corey, I'm good.
Oh,
I'm not ready for that.
I know, I can't believe like we got like 11 weeks and then we're like in the real world.
Yeah.
a little scary.
We're in the big world.
It's,
in the big leagues, Corey.
I know, you're gonna do big things.
Big old leagues.
And of course, this is gonna be the quarter that goes like, so even though you aren't going to be going in July, I still want you to fill it out so that way when you do go, I can just pull all that information and not have to bother you too much on your maternity leave. Okay?
So my son's skin condition that he has is contagious, so
Oh.
I can't get him into a daycare.
Oh no.
So-
Oh,
Do
no.
there hospitals or anything that do externship? Because it would have to be like a nighttime.
So that is an issue. And let me explain to you why. Most of the time we don't send you guys to a hospital, and even if we do, it's a clinic within a hospital. And they don't typically work the later hours. Now, could I potentially get you into like an OSF prompt care that you could work? Well, that's probably not going to work either.
So even like the prompt cares are usually like daytime hours.
Yeah,
for the
so
externships.
So like Crusader typically doesn't let you be at the site after a manager leaves in
Oh.
case there is an issue.
Okay.
OSF will, and I used to have students that would work like from 5 to 8, but now they've lowered their hours, so now they're not even open till 8 anymore. So that might be something we have to discuss in the future. Because now I'm gonna have to think about it. But yeah, so if you guys have questions about like where you want to go, please let me know. We can kind of work through that. If you work for a clinic or a department or a hospital system, please put that on there as well, because I typically don't send you to where you work. I think you're the only one that I have that issue with.
Not anymore.
Uh-oh.
What? Ooh, juicy details.
I just don't work for nursing.
Oh, no, but you're still working somewhere, right?
Not right now, no.
What happened?
It's a long story.
Feels like it's been months.
I know,
Oh my
like,
God.
what happened? Like, you guys went on a 2-week break and it's been 7
So
years.
much going on right now that like working is like
Okay. Well, so
That's
then you
good
just
thing.
get me.
Yeah.
Well, and then whoever your lecture teacher is.
Concentrate on school.
Who is your lecture teacher? Have you guys looked?
Leah. I'm so excited, Corey.
I'm so sorry I asked.
Corey, I'm so excited. I'm so excited. I love my life.
Who's you guys is? Is it Leanne?
Yeah. We
So
all
I
like
figured
it
out why
all.
she wasn't emailing me back.
Okay.
She has 2 emails, and one is disabled.
Oh.
Because I guess she used to be a student here.
Yep.
And yeah,
Yep.
her student email still pops up when you type her name in. Yeah.
Why are you not just emailing through Blackboard?
I just always go to Outlook.
Okay. So, outside of what we just kind of went over, initial stuff, you should have in your packet of fun a syllabus sign-off sheet. Everybody got that? I'll have you fill that bad boy out first. We'll start there.
Are we
Uh-huh.
keeping all these papers in?
You can keep all of the papers in your charts if you want. You don't have to. If you want it to be cleaner, you can take those out. I don't need them anymore.
The injection laws and stuff too?
Yep, those are all done. All right. Does anybody have any questions about the syllabus or what's going to happen this quarter?
It's probably gonna be the same like last.
Very similar to last quarter,
Except
right?
we say we have writing assignments.
Right, so here's the difference. So for the 6 of you that I had last quarter, you guys were getting points for rooming every week, right? That's not how that works in this quarter, right? It's just all practice. So for you, it's just all practice. It's fantastic. Next quarter, we'll add in the points for you, okay?
Because we did it 2 and 1.
Right, so because you guys went 2 and then 1,
Will she be by herself next quarter?
no. She'll have all of the new students that are on
okay.
Thursday with her. So you'll be in another class of, there'll be 6 of you total next quarter. So she'll never
She'll be the big dog.
She will.
Yeah.
The only time you're ever going to be alone, and you're not actually going to be alone because Serenity will be with you, would be externship. But you won't be alone then because she'll be with you. So no, she won't be alone. So because of that, it's kind of a little flip-floppy. So the more intense class you guys took first, now this is like the step up from last quarter. So for you, we're going to go a little bit more intense, but not crazy. For you guys, we went intense, and now it's going to be a little bit less, right? You don't have to do ICD-10 coding. You don't really have to do charting unless, it's a good idea for you guys to keep charting. Right, it's a great idea to have you guys keep charting for practice. However, it's not a graded thing. But it does help with your midterm. It helps with your documentation skills, all of that. There are more written assignments, though. And a lot of them will be in-class activities that I'll give you time to do. If you don't get them finished, then I'll have you bring them back the following week. Okay. So like this week, we've got a pretty heavy in-class activity. The likelihood that you finish it while we're in class, not much. But we'll still have you guys do it, bring it back next week. Okay. So if you guys don't have any questions on the syllabus acknowledgement or the syllabus itself, pull out this sheet here. Top line is going to be your name. It says that you have read and understand the course syllabus for. I filled in the course title, which is MEA1460L. It's taught at the Rockford campus by me. You will initial under the laboratory safety. Everyone remembers where the first aid kit is. Nice. Where is the lab and safety manual? Nice. Where can you find gloves? Literally, you could just do this. They're literally everywhere. Gauze, bandages, alcohol. There. Really, they're kind of all over as well, okay? You guys understand that at the end of every day, what do you got to do? Wipe your table and push in your chair. If you spill blood, bodily fluids on your table, got to clean that up. We will deal with urine and feces this quarter. Joy. If you watched the live lecture yesterday, you got to hear about that. Tiffany's reaction. Tiffany's reaction on the live lecture is my favorite thing. She was like, no. No. And I was like, it's okay. It's not mine. It's not yours. Dog, but I don't think that makes it any better. I mean, maybe.
I worked in a lab.
I did too. But there's some smells that you can't unsmell once you smell them.
Like C. diff?
I had C. diff.
That is like the worst.
Okay, changing a poopy diaper and me handing you dog feces are two totally different things, and you are super pregnant. You will be super pregnant when we get there.
I definitely feel like dog poop is better than human poop.
You and I have different opinions, but that's okay.
But that's also because I worked at a vet too.
Oh.
And I had to do fecals like every day.
So you're kind of used to it, yeah.
We're gonna be over.
Yeah, well,
It's
today's
okay.
the day
I
that
can
I'm
handle
gonna
it.
gag all day, so it's
What?
fine.
What?
Today's the day that I'm gonna gag. all
You
day,
are.
so
You
it's
are
fine.
gonna get. But good news, we get it out of the way. It's done. It's over. You don't have to do it again this quarter. Well, I don't want to say that in case somebody does pull that unit and you're their patient for
Great.
final exams. Then maybe, but that's a whole nother story.
I love that for me.
We all understand the attendance policy. How many hours can you miss? What about online? 14 days. Yep. If you go inactive for 14 days, they automatically kick you out of the course. And if you fail lecture, you also fail lab. Okay. Glad we understand that. We understand the late assignment policy. How many days do you get after an assignment is due to turn it in?
7.
Good. What happens for every day it's late?
10%.
Okay, cool. Glad that we understand that. If you agree to all of that, sign and date the bottom. At some point, actually, just stick it in your folders, and when you turn in your folders at the end of the day, I'll grab it from out of there. And so, like I was telling not Tiffany, your Taylor, Tease, if you want to keep your folder clean, like you don't want all of the papers from last quarter in there, you can remove all of them. So all of the rooming sheets that you've had, all of the log sheets that you had, we're not going to use those this quarter. So if it bothers you that they're in there, you can remove them. And then what I'll ask is that you just leave them in a pile somewhere so I can shred them. So that way we don't have like patient information like name, date of birth, and all that just in the garbage. Okay. I realized that I forgot to correctly hole punch your skills log. I gave you a 3-hole punch, not a 2-hole punch. I should have 2-hole punched it. So I'm going to grab my 2-hole punch at some point because we're going to keep those in your folder as well. There's a lot more skills, I think, this quarter, or competencies per unit that we're going to go over. We're going to start today with doing a full section. So the respiratory section will all be signed off on today. So if you look at it, it's a pretty hefty section. But it is definitely something that is able to be done in the 11 weeks. Are you going to get every single injection slot filled out? No. But I want to at least try to make sure that we get one of each of them. So we will learn how to do deltoid injections. Actually, we know how to do deltoid injections, subcutaneous injections, and intradermals. We're going to add in Z-Track for those of you who haven't done them, which I think is everyone except for Carla. And then, did we do gluteals as well?
Yeah.
Okay, so we'll teach you Z-Track and gluteal. Okay. We're going to do the butterfly venipuncture as well as the vacutainer this quarter. So everybody's had a chance to do a couple of those. You don't have to do syringe in this quarter, so we won't be doing them. If you want to do a syringe because we only learned it last quarter, that's fine. Just ask me and we'll kind of walk through that process together. Okay? Questions? Okay. And then I am going to get my PowerPoint up so we can talk about pulmonology. Are we so excited about pulmonology? Pulmonology is a thing in my family. What does that mean for us?
My grandpa's got emphysema. My grandpa's got COPD.
Okay, so what you mean by that is you have a big family history.
Yeah.
Gotcha. I also have a big family history of it, but mostly it's me. I have had pneumonia twice. You're like, Corey, you're so young and beautiful. I know, thank you. I have to. You guys have been on break for 2 weeks.
I literally said to my fiance yesterday when I was watching the live classroom and everybody kind of talked a little bit, I'm like, I missed these guys.
Yeah.
I did.
Oops, wrong way. I have to make it fun and exciting because I'll be completely honest with you, some of the content just isn't. Like, it's just not fun. So I try to make it fun. I'm trying to make it light. I try to make it exciting. But also it's 9 a.m. on a Wednesday morning where it had potential tornadoes this morning.
That last hour I had to sleep too.
Yeah, like nobody, and call it what it is, nobody wants to be here. Maybe you do, maybe you don't. But the truth is that half of you would like to have stayed in bed today.
5 hours away from kids, so I'm good.
You know, I'm alright with that too. I'm not gonna lie.
I love you. guys.
Getting away from a 2 or 4-year-old for a few hours.
I-
is really relaxing.
Love you guys.
Oh my god. See you today.
Nice.
Well, and actually I won't see him until 10 because we're going to the Bulls and the Bucks game tonight. In Milwaukee.
That sounds awful, but I mean, good for you.
I don't know anything about basketball. I just know I'm going.
You're like, I just go because there's food.
Yep.
Sometimes that's why I go to games too. Like, I have no interest in certain things, but I'm like, but I know that they got good food.
Yep.
So, when you hear the term pulmonology, what does that mean to you? What?
When I hear pulmonology, I think lungs.
Lungs. Okay. Is it just lungs? No. Okay. What when we say pulmonology, what all is it referring to?
Respiratory system.
Your respiratory system. Where does that start? Mouth and nose. Yeah, because we're taking in air that way, right? Like we're taking in oxygen and carbon dioxide in that respect. It then travels through our larynx, our pharynx, into our lungs, into our bronchi, into our alveoli. And the thing is that it actually deals with our cardiology system as well, because that's where the changing of oxygen and carbon dioxide happens, is in our blood system. So while pulmonology typically refers to lungs, it's going over a little bit more than just lungs, okay? So a lot of my PowerPoints that I'll show in here are going to be over things that are going to be procedurally based. So the procedures that we're going to do, I'm going to walk you through them in these PowerPoints, okay? It's not going to be too much content. However, I would recommend watching my course announcements, because those are where I'm going to give you some of that content, okay? So, a couple of things that we get to do is we do a lot of respiratory testing. So the first thing that we do is a pulmonary function test, which also could be called a spirometry test. They are terms that are synonymous with one another. So if you hear me say PFT or spirometry, I'm referring to the same thing. We'll do peak flow measurements and what a peak flow rate is, and then we'll also do TB testing. So TB testing is what kind of injection? Intradermal. Where is it administered at? And what angle is it administered at?
10 to 15.
Good. And what do we want to see happen?
Wheel.
Very good. Do you put a bandage in the real world on a TB test?
No.
Look at you guys are just so good. I'm so excited. Now, is it your job to perform these tests? Sure. Is it your job to know what is normal and abnormal? No. Is it your job to tell the patient something that is abnormal or normal? No. It is your job to just be able to perform the testing. Now, should you know what is normal and abnormal? Absolutely. But it is not your role to diagnose or anything of that nature, okay? So, as we get into this, the first one that we're going to talk about is the spirometry test, or that PFT. And I know that your lecture course, the discussion board, kind of talks about this as well, in respect to how would you educate a patient about it. So what are some things that you noted when you talked about the spirometry test for your discussion board?
Not to eat. Well, not to eat. Was it 4 to 6? I think it said 6 hours before.
Yeah.
And then no smoking.
Okay, so no eating a big meal.
A
Now you
large
can
meal,
eat.
Yeah, eat light.
Yeah, eat light. You don't want to have a big meal, and you don't want to smoke 4 to 6 hours before the testing. Do you guys know why?
Because your lung capacity is not complete, or there's still stuff in there.
So, kind of. With the meal piece of it, if you have a big meal, your stomach expands, right? And that's going to push up. If it pushes up, what is it pushing into?
Your lungs.
Your lungs. Then are you able to get a big deep breath from that? No. So, if you try to, when you're doing the spirometry test, and you're trying to take that big deep breath, but your stomach is expanded, it could cause you to vomit. No offense, nobody likes vomit. There's not a day in my life that I'm like, you know what? I'd take vomit. Okay? We tell you not to smoke. What'd you say?
So would I.
Yeah. We tell you not to smoke because those are vasoconstrictors. So what's going to happen is that instead of having your lungs be completely open, they're going to close everything off. So you're not going to be able to get those good breaths that you need. Even though if you ask somebody who is a smoker, for whatever ungodly reason, their brain tells them that after they have taken their cigarette and they've smoked, that they can breathe better.
My grandma says that to me all the time, and I want to just smack her.
I dated a guy in college that used to say that to me, and I was like, you know, logistically that makes 0 sense, right? And he's like, no, I breathe better. I'm like, no, you're cray-cray. Deuces. I would love to say that that's why we broke up, but it wasn't. We also tell the patients not to use any of their inhaler medications 4 to 6 hours before if they can avoid it. Same thing with not doing a nebulizer, because that's the opposite effect. Those are dilators, so that's going to open everything up. So if it opens everything up, we're not getting a true picture of what's wrong with your lungs. So those are the things that we kind of tell them to avoid or not do before. We also tell them to wear loose-fitting clothing. That includes bras, shirts, pants, all of that. Because again, if you have tight-fitting clothing, are you able to get a good big breath in? No. I always think about my wedding. My dress had a corset in it. Now, I looked fantastic, but I couldn't breathe for like 12 hours. And I remember being like taking it off that night and just being like,
It's like when you're pregnant and you
Yeah.
get the baby out.
yes!
And you're like, you can breathe like a full breath
Yep.
of air.
You're like, oh my God, those are what my lungs feel like.
That was me yesterday after the chiropractor.
Oh yeah, there are times that I leave the chiropractor and I'm like, oh my God, I haven't been breathing right.
I got cracked so hard yesterday that like I sat and was like,
Yeah, it's so true.
and I'm so sore today, but I feel so much better.
You're like, it was awful, but it was worth it.
Oh, I should have heard him crack my neck. It was sick.
I laugh hysterically when I get big cracks, and I don't know why. Like, it's just like I giggle, and I can't control it.
I just did like a, and he's like, "Are you alright?" I was
You're like, yes, I feel wonderful, thank you. Now, some of the equipment that we're going to need are going to be, let me pull them out as I kind of go through it. You're going to need a nose clip. Nose clip. I'm trying to get it in the, let me explain why. Don't look at me like that.
No, I watched the videos.
I know. Well, they probably didn't even use this old machine either.
Probably not.
You need the ancient machine,
Yeah, they definitely use the ancient one.
right? No ancient machine. You need a spiret, and these are all disposable, so they're one-time use only. So, these are the 3 big pieces. Now, normally you would also need to take the patient's height and weight, because all of that information goes into the machine. For today, that's not what we're going to do. We are going to do a quick test, and I'll kind of walk you through that. So, as you begin, you may want to make notes on this. Just say. Look, everyone's like, wait.
I made notes on the last one, but on the videos, but
It's okay. Yeah, so here's the thing. I would love to say that we all have the exact same equipment throughout all of the program, but we don't. Some of our campuses are newer, so they got new stuff. We have geriatric Ginny over here.
you said this and P.
Yes. So, first thing that you want to do is obviously just turn on your machine, and all you have to do is press and hold the on-off button until you hear it click, and it will turn on. Now, the nice thing about this machine is it also does like a self-test to make sure that the internal pieces are working bueno. Okay? Now, once you get it on, there is a screen that gives you a list of things. You want to perform tests. So once you have that highlighted, you just hit enter. And then you're going to select the test that you want. And there are 3 options. The options are new, recall, or quick. What one did I say we were doing?
Quick.
Quick. So I'm going to arrow over until quick is highlighted, and I'm going to hit enter. Now, once you get to that screen, it asks you what kind of test you want to perform. Here are the options. You want an F, FVC, an FVL, a tidal FVL, an SVC, or an MVV. We are going to do the one that is expiratory. So we are going to do an FVC. That is the test that we want to do. You want to make sure that one is highlighted, and when it is, you hit enter. Now, the next screen is where we're going to stop, finish setting up our machine, and tell our patient how to do the test, okay? So, first thing I do is I set up the machine. You're gonna put your Spirette into the machine. Now, again, these are one-time use only, but you don't wanna touch the mouthpiece or where your patient's going to be touching. So what I do is I pull the perforation, I hold my plastic over the mouthpiece, and I pull out just essentially the butt, okay? Now, you wanna find on the Spirette, there's a little arrow. I'm really struggling. I haven't played with a camera in a while. Can you tell? You want to line the arrow of the Spirette up to the arrow on the machine. And the reason that you want to do that is that you want to make sure that the holes of the Spirette match up to the holes in the machine. So we're going to push that in until it's all the way down, as far as it can go. And then I pull that plastic piece off. So now, this is set up for the patient. This is ready for them. This is now where I give them the instructions. Do you think we want the patient to be sitting or standing? Why? Why sitting?
More relaxed and they can sit straight up.
Okay, more relaxed, they can sit straight up. Beautiful. The other thing is as we're doing this, if they're standing up, they could potentially pass out. That is a no-no situation, okay? We want to encourage the patient to sit up as they're doing it, because if they start hunching over, what they're going to do is they're going to close off those lungs as well, okay? So they want to stay upright as much as they can. Is this going to be difficult? Yep. It's not easy. You're going to have the worst time, okay? Not only is it going to suck because you have to do this, but you're pregnant, so you got a little... You probably are not going to have a great time with this either. Now, I will tell you, as you guys are doing this as the MA, you want to document how many attempts it takes the patient to successfully pass. And passing for this is a B or higher. Okay? The maximum attempts that a patient can take is 8. So,
What did you say? It was a what or higher?
B. B as in boy. I also encourage my patients that before they put their nose clip on to take some nice, good, deep breaths to get themselves ready. And then when they are ready, that's when we're going to begin the test. And what they're going to do is take that deep breath in, put their nose clip on, and hold it until the machine is ready. And then they're going to blow out as long and as fast as they can. Okay? What is my job as the MA during this test? Coaching them. What are some coaching things that you could think of?
Just encouraging them as they're doing it.
Yeah. Is it weird to say, yeah, keep going, blow, 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 blow? Yes.
Yep.
Okay, right? Like, call it what it is. It's weird. It's funny. It's funny because you guys know one another. When it's not somebody you know, it means nothing, right? Will you probably laugh during this? Probably. Okay? Just call it what it is. Now, when your patient says that they're ready to start doing the test, they're going to put their nose clip on, and I tell them to just breathe normal for a few minutes, okay? Yes, I understand what I sound like right now. I don't need you to tell me. I know. Okay? Your job is to now get the machine ready. So what you're going to do is take one of your hands and cover the bottom of the Spirette, because you have to set the baseline. In order to set the baseline, you have to make sure there's no airflow in. So we cover the bottom of the Spirette with one hand. We press enter with the other hand. When you hear it double click, it will say machine ready or begin test or something like that. That's when you're going to hand it to the patient. Make sure that the patient makes a good seal around the mouthpiece. There are grippies on the mouthpiece. I typically tell patients to give it a little bit of a bite down, not like a bite down because then you're going to close off the airway, but enough that it makes their lips purse around it. Okay, so more like a how many days are you going to get to see me do that? 0. Today. So I'm going to do this both parts for myself. Obviously I'm not going to be able to coach myself during this, okay? I'm also going to go ahead and tell you I have crap lungs. So when it looks like I'm dying a little inside, I am. But I'm doing it for education. Okay? So get this going here. The hard part is you want to take a breath in, right? You can't take a breath.
Doing it, you mean? Yeah.
You want to just blow everything out of your lungs, okay? Now, patients in between can take their nose clip off. They can take breaths. I typically give about, 5 to 10 seconds in between. I don't want to go back to back to back to back to back because then they will pass out on me. So I look at the graph. It means nothing to me, okay? It's going to mean nothing to you. It'll look like this, and then just, that's it. I'm going to hit enter. Now, on the enter screen, a couple of things you're going to see. You're going to see any feedback that the patient needs. So, and you're also going to see their grade. Huh?
What'd you get?
I'm going to tell you. Okay. Now, let me go ahead and preface this. Is there any nice way to be like, okay, well, you got an F.
We're gonna
No.
do this again.
Right? There's no way to say a nice word about a grade that you get lower than a C. So instead, what I say is, you know what? That was a really good attempt. We're going to go ahead and do the next one when you're ready. Because that's all it says.
People get annoyed having to keep doing this.
Probably.
Yeah, I figure.
It does say good effort, do next. So that's kind of what I'm encouraging. I got a D. That's actually pretty darn good for me. Normally it's always an F. So hashtag that's cool. Okay, so that was my first attempt. When the patient is ready, they'll re-nose clip, take their big breath in and hold it, and then you just have to hit enter. You don't have to cover it again. So,
I was just gonna die for a second.
just a little bit. Again, gives you the graph. You hit enter. Okay, so now, good news. I still got a D, right? So that's 2. But this time it says deeper breath. So that means I didn't take a big enough breath in at the beginning, okay? And so we're going to continue this until one of 2 things. A, it says, congratulations, session complete, and you've realized that it's less than 8 attempts. Or it says maximum attempts reached. Then you've reached 8 attempts, okay? When that has happened, all you have to do is press and hold the on-off button until it turns off. I push from the bottom of the spirette up, and then I can grab under the lip and pull out so I don't touch their ickies. If you want to keep the nose clip, you can. Otherwise, everything is garbage, okay? Questions about how to do this procedure?
What? I want to keep the nose clip on specimen.
I mean, if you want one, I can give you one at that time. Any questions about that? Okay. Now the next couple of slides, I realize I have gone over the instructions, but they are just showing you. This is really old. This is geriatric George. So once upon a time, it was all connected. This machine actually has a docking station that you can dock into and then print the results for the provider. We're just not going to do that for here. Okay. And so this is what the printed version would look like, the printed instructions. So that's what that looks like for the provider. it takes essentially their top 3 that they do, even if it takes more than that to complete it. But we just go over the top 3. Okay?
So what happens if they hit the 8 and they don't pass?
Well,
That's just up to the doctor? then?
that's up to the,
I
yeah.
gotcha.
Provider just then at that point decides what the plan of attack is for
Okay.
procedure, for treatment. Yep. Okay. Now, here are just the instructions that we already went over. Just trying to make sure that I see all of them. If you want to go back through them, they're there for you, but we went over all of those steps already. Okay? The next one that we have is a peak flow. Anybody ever had to do a peak flow? Anybody's babies ever had to do a peak flow? Anybody ever seen a peak flow? Okay, you're like, wait a minute, that looks familiar. So, peak flows are done typically on patients who have asthma or emphysema or COPD. So all of those are obviously pulmonary disorders or diseases. Typically we see this done on asthma patients, okay? The only other time I think you would ever see a provider order you to do one of these is if a patient has shortness of breath, unexplained shortness of breath. So with the peak flow, this is the actual device, and then we have little plastic mouthpieces that go in. These are disposable, so we can continue to use the same machine, but we don't have to have everybody's goobies on the machine, okay? Yes, I said goobies. What you want to make sure is as you begin this, that the arrow is all the way at the bottom, so the red middle arrow is all the way at the bottom. And providers actually can adjust the arrows on the side. So the red, yellow, and green arrows on the side, they can preset those for the patient on where they would like them to see them be, okay? So I've just set them today. The red arrow I set at 100, the yellow I set at 250, and the green I set at 400. It's kind of like a stoplight. Think about this. Red is stop, okay? In this world, if I have a red and I'm in the red zone, that's not good, right? Then we have to really look at their treatment plan and see if we need to maybe up medication or maybe start medication. Yellow. You should stop, but you could hit the accelerator and go through. Don't lie, you know you do it. Really what that means is, okay, this is moderate, you're better, but we would like to see you a little bit higher, okay? So maybe again, it's a treatment adjustment or an increase of medication. Green.
Good to go.
Good to go. That's exactly where we want you to be. Treatment's working just fine for you, okay? We're gonna do this 3 times. Now, this is where I have to be a little bit cautious about how I say this. I was always taught that you do it 3 times and you take the average of the 3. Well, how do you do that? Does anybody know?
Add the 3 and then divide it by.
Yeah, so you add the 3 numbers together, you divide by 3, that gives you your average, that's what you write. Some providers will say that you want to take the highest of the 3. Okay? We are going to do the highest of the 3. And you record it in liters per minute, so L/MIN. Now, for the peak flow, they can sit or stand, totally their choice. They're going to do 1 quick breath in and blast it out. So what I mean by that is, right? The last one we were like, this one, just quick in, out, okay? And as you do it, that red middle button will shoot up. You record that number, lower it back down. Same thing. They blast out, shoots up, you record it, lower it back down, okay? So, they're gonna hold it. It has a nice little cute handle for them. Same thing, make a good seal on the mouthpiece. They can take a breath in and then blast out. So, whoa, whoa, that was pretty cool for me. That was pretty good for me. I'm pretty excited. Now, we have the main numbers that you'll see. So I think it's 100, 150, 200, 250, 300, 350, XOXOXO. Every little small hash line in between is 10. So I just got a 310. Okay? Lower it back down. Give it back to them. I'm never going to get that again. I know it. $300. Told you. $280. So, if you were writing my results down, what would you put? 310. Then you can take this piece off, throw it right in the garbage. Okay? Now, sometimes when we do a peak flow, we can do them in the office, or we can send the patient home with the device. If we send them home with the device, what we want them to do is take this at least 3 times a day. What do you think the 3 times a day are? Morning, lunch, and night. That's not bad. Morning for sure, night for sure. Lunch is a little hard, especially if we're doing this typically on kids. So instead of lunchtime, when do you think they would do it? How old are these kids that you think we're doing this on?
I can take a nap every day.
You could. You're an adult. Kids at a certain age and they're like, no naps.
Before playtime. Or after playtime.
Okay, we're gonna call who we're doing this on school age kids.
Okay, after school.
After school. Yep. So in the morning, when they first wake up, after school, before bed. We also want them, now this is a little bit harder, it's typically adolescents that we can get them to do this, or even adults that we do this on. We have them keep a diary. What do you think the diaries that they're going to keep is about?
The 3 scores they have.
Okay, so maybe their daily scores. Yep.
Their activities.
Their activities.
Their eating.
Maybe, because if
How they're breathing.
yeah, so if they have issues with their breathing, we want to know when it happens, right, and what caused it. So maybe it is a food. You know, I ate strawberries and then I started feeling short of breath, or I went for a 4-mile run and then I started feeling short of breath, or I walked from my car to the building and got out of breath. Okay, we want to know what that activity is, what triggers that shortness of breath. Procedure number 2 makes sense? You guys have any questions? Okay. So again, these are the instructions for how to do that. If you have any questions, we can go over that. Now, I want to do a little question and answer sesh before we go over the rest of your procedures for today. So question number 1, which of the following is the amount of air that is forcibly exhaled after a normal exhalation? Is that a tidal volume, expiratory reserve, inspiratory reserve, a total lung capacity, or a residual volume? Okay. She said, wait. Anybody else want to throw out an answer before I give it? What? Expiratory. So I've got B and I've got E.
I might.
So
I take that.
she's like, I'm taking that back. And that's okay, because in the Kahoot game, we did have residual volume, but that was after inspiration, so taking a breath in. We're talking about taking a breath out. That is a total lung capacity. That is everything that your little lungs can hold. Before I move on, what is a normal respiration rate for adults? Adult patients. There you go. I was like, why is nobody answering me? 12 to 20 breaths per minute for adults. What about newborns?
They're higher, aren't they?
Yeah. Why are they higher?
Because their lungs are smaller, so they're breathing more.
Their teeny tiny lungs are just doing their whole job so quickly. Okay? Their little lungs, think about this. Their little lungs are about the size of their teeny tiny little fist. Okay? So they're going to have somewhere between 24 to 32 breaths per minute. Which, if we did that as adults, would be like, yeah, 24 to 32. Okay? That's normal for them. They have teeny tiny lungs.
You said that was
Newborn. Typically, it's going to be newborn up until the age of 1. Okay? At 1, they'll start to slow down a little bit, but they're still going to be somewhere between 20 to 30 breaths per minute. When they get to be about 5 to 6, that's when they're going to start to come down to like the 18 to 24. And then when they actually are about 10, that's when they get down to like 12 to 20 breaths per minute. Okay? I just wanted to throw that in there while we were talking about respirations. All right. Which of the pulmonary function tests is not usually performed by a medical assistant? Is it a spirometry, drawing blood gases, peak flow measurements, oxygen saturation, or administering a nebulizer treatment?
arterial blood gas.
So you're saying B, arterial blood gases. Yeah, it is ABGs. That's what we call them. You have to be a specialized phlebotomist in order to do them, because where we're drawing from is right here. We draw from their artery, their radial artery. And you have to make sure that you feel the ulna artery the entire time, because if you do this one wrong and they lose that ability to have blood flow, they will lose this one as well, and it can make you have to cut their hand off. Hence why we don't do them, right? So what they do is they actually put the needle into the artery, and they don't actually pull back. It pulses the blood out because of the artery. So super cool if you ever get a chance to see it. However, absolutely terrifying if you have to do it. Have you ever done EBGs?
Yeah.
No, and typically nowadays waves don't even do it anymore.
I know.
Unless like you're in like you have to
Like-
have like special training for it. Typically the doctors do it now, or the nurses.
Yeah, doctors or nurses, or they pull in respiratory phlebotomists,
Yeah.
who this is their whole job.
Yeah. I've never done them because I never had to.
Yeah,
They typically have like the respiratory people do it,
yep,
or nurses or doctors.
yeah,
Because
and
it's so like
it's like I watched it once and it was absolutely terrifying for me, and I was just watching it. It also doesn't feel great,
no.
right? Like
They're
it,
literally straight up and down poking you. Like
yeah, and it hurts. It hurts the patient, and if any sort of movement happens, they could lose that pulse altogether. So that's why we don't do them. We talked about doing spirometries. We talked about doing peak flows. We've learned how to do oxygen saturations, right? You guys know how to put the thing on the finger and read that. And then administering a nebulizer treatment, you can do that with a provider order. I'm going to show you how to do that here in just a minute. All right. When performing a spirometry test on a patient, the medical assistant must what? Is it A, leave the patient alone during the test, B, act as a coach to encourage more effort, C, provide the patient with reading material during the test, D, be quiet so the patient is not disturbed, or E, give the patient results right away? Sorry, I realized that my finger and my thought process were not the same. What we say? B as in boy, D as in dog. Thank you. B as in boy, you want to act as their coach. Okay, I'm also going to preface, I did not make this slide deck. I've had it for a million years, so I did not pick this picture.
Oh my gosh, I was cracking up at the picture during the Kahoot game of the suffocation.
I know. It's a screen capture from Seinfeld. Again, I don't make them. I just use them. And here's the thing. I probably should like review them before I use them because I got to that screen and I was like, oh my God, don't laugh. My little floating head over in the corner. I'm just like, all right. Do you guys have any questions about this and what we went over? What? She looks cross-eyed.
Yeah, she's like,
We'll talk about what that term is next week when we talk about eyes. Yeah, I hate it. I hate that picture so
Can I
much.
go to the bathroom really quick before?
You can walk there.
Oh.
I would suggest walking there. Okay. I'm going to turn this off and go over the last couple of procedures that we need to do. And then we'll break into teams. I guess the kind of nice thing is that we have an even number, so everybody will be paired up with one person.
pack.
What?
So not a 3-pack today.
No 3-pack today. However, once Brenda is back, there will be a 3-pack because we have an odd number.
Oh man.
I know, I'm sorry. Also, I didn't make this. I didn't make us be these people. But you know what? I'm really, really, really happy with this group of humans. I feel like it's going to be a really, really good quarter. Minus all the crappy starts. But we're going to have a really good quarter, and I feel it, and I hope that you guys feel it too. So I'm going to get this set up while we wait for Ashley to get back from the bathroom. In your procedure packets, I've given you all of the information for all of our procedures. I don't need these documents back. They are yours to keep. So as we're kind of going through things, as you're studying for final exams, things of that nature, you have these to go over, okay? It does go over the steps as well for you. So the first one in your packet is performing a spirometry test. We talked about that one already, so I'm not going to go over that one again. However, if you want to take this document with you when you're doing that procedure, so that way you can document how many times it takes your patient to do it, perfectly fine. The only time I'm going to need that information back is when you are putting it into your skills log, okay? You can also look at these in your textbook, your MindTap textbook. If you go to chapter 39, and 39.7 goes over, obviously, your spirometry test. The next one is 39.8, which is doing the peak flow. We already talked about that one as well. Measuring and recording pulse oximeter. We're not going to do that one as a group because when you room today, you're going to do that. That makes sense? Everyone remember how to do it? We were doing it last quarter, right? No. Okay.
Are we gonna have scenarios?
Nope. You will not have scenarios this quarter. Instead, what I would suggest is have an issue related to whatever our topic is. So today is pulmonology, so have a breathing issue. Does that make sense? Okay.
Are we doing flashcards?
No flashcards.
Not lighting my backpacks? Oh,
Yeah, no flashcards this quarter. So, with a pulse oximeter, what you're going to do, actually, you guys tell her. Pulse oximeter goes where? On an index finger, a middle finger, a ring finger, anything but a thumb. Okay? What is it doing?
It's measuring
Oxygen saturation in your blood. What are some things that we want to make sure the patient does or has?
want to make sure their fingers are warm.
Warm. You want to make sure fingers are warm because if they are cold, it's not, that infrared's not going to get the sensor.
And then no red nail polish.
No red nail polish because that will interfere with the sensor. What if we have an infant and this can't fit on their finger? Toe or heel, perfectly fine. There's one other place that you could do it. Earlobe. No, not very common. Okay, you get to touch baby feet and human fingers. That's it. Now, when you look at this, it's got two numbers. The top number is your oxygen saturation. What do we want that to be above? 95. How do we write that number? It's a percentage. So mine, as I'm sitting here walking back and forth and talking, is 97%. What's the bottom number? Pulse. Are you using this to take a pulse? That's right. You can check yourself before you wreck yourself. You can check yourself, but I want you to actually do it by hand, okay? So when we room today, that's one that we're going to just add into the piece. I typically have students do that as the absolute last vital sign, okay? All right. The next one in our fun packet is in chapter 43, and it is instructing a patient to collect a sputum specimen. Let's start with the term sputum. What is sputum?
Mucusy stuff from the lungs.
Mucusy stuff from the lungs. She's not wrong.
Sick.
It's not pleasant. When do you think is the best time for us to do a sputum specimen collection?
Morning.
First thing in the morning. Why first thing in the morning?
Because you're hacking everything up from laying down.
Yes, so the reason that we do it first thing in the morning is because all of that crud, essentially because you've been laying down, has had a chance to settle in your lungs. We now have to get that crud back up, okay? So if you think about it, most people in the morning have those like deep, hacky coughs. That's where that crud gets kind of loosened and brought up. I'm not gonna make you do it. This one is just,
Oh, good.
this one is just discussion,
Oh,
okay?
I was so concerned.
No.
Oh.
Now, what, and it's typically done in a hospital setting, so it's not even something that we would do in a clinical setting. What would be a diagnostic reason to do this? What would be? TB. Yep, that's the big one. So, if we suspect that they have tuberculosis, we're going to test that with the sputum. So, what we do is we have them sit upright. We have them do some of those big hacky coughs, not like a, I'm talking the ones that come from like deep within the bowels and bring them up, right? We're gonna have them remove the lid. Now, there's also discussion on which way people do it. Some patients they'll tell you just to spit into the cup. Some places will have you spit into the lid. The gross part is what I'm about to tell you. So if they have you spit into the lid, what we're doing is testing the thickness of it. So you leave it, you do your specimen, you leave it flat, you put the lid on, and then you actually flip it to see how long it takes it to drop. Every single face just went,
Sputum is the worst thing
It is.
ever. I would rather do with seated than sputum.
look, poop's coming back. Now, what we don't want in the cup is just our normal saliva from our mouth. We also want to try to avoid having them put any tears in it, which you're probably like, tears? But if you're doing those big hacky coughs, the natural reaction is for your eyes to well up in water because of the fact that you're actually adding extra pressure into the eyes. So, no saliva, no tears, no mucus from our nose, so no snot. You want just that thick disgustingness. You all know what I mean, right?
Yeah,
like
that.
when I talk about the thick mucus, you know what I'm referring to? Yes?
Yes.
And here's the thing. If they really do have TB, it's typically going to be like brown in color.
It's got like blood in it.
And it could have blood in it because of the irritation of coughing it up. Okay?
What's something else that you can use it for? I know TB is like the main one.
TB
but-
is the main one. If we're contemplating if somebody has like emphysema, lung cancer, we have some of the same issues. Yeah. That one is just a demonstration only. So, get out your skills log, because we're going to just knock this one in the bud right now.
I was afraid we were gonna have to like.
No, we don't actually have to do any of the hacky uckies. That's,
I had to do that.
I've had a child for far too long when I say the hacky uckies. Okay. in the section on page 8 that says respiratory specimens and treatment, there is one that says obtaining a sputum culture. For right now, go ahead and leave the patient name part of it blank because I haven't given you who your patient is today. You okay? Is that hiccup? Gotcha. You can date and time it. It is April 5th, so 4/5 of 23, and it is 10:30.
10:06.
Your clocks aren't right.
Forgot about that.
Did the time change happen while we were on break?
Uh-huh.
Did it really?
Uh-huh. I had to think about that earlier too when I looked at it. I'm like, I feel like that happened way before we got done with school, but it was while we were-
Okay.
Yeah. I literally.
I will
had
fix the clocks,
conversation
I
in my
promise.
head.
Yeah, it's 10:06. Holy Jesus. I'm okay. I just realized that is not charging. Why are you not charging? Because you got to turn things on, Corey. Good God. Okay. Day one. I'm okay. So for results, you can put WNL. What does that mean? Nice. Okay. Next in our packet of fun is obtaining a throat culture. This is a dual procedure because it's obtaining a throat culture, but we're also going to do a strep test with it. So, I know, I'm sorry.
They're laughing because I'm the only
Hey,
one
we
who's
just
not
looked at
talking.
you.
So you have to go like down my throat.
Yes. So, obviously those of you who I had last quarter, you guys remember how to do this, right? Pretty great. Awesome. Wonderful. Miss Carla, this is a new procedure for you, but have you ever had a strep test done before? Lots. Okay. So you know the basic procedural piece of it. You just need to know the technical setup piece of it, okay? So, typically, and I'm going to show you this to you guys because it's not what we use on campus, but if you are in a clinical setting, you are going to use a kit like this. And it's going to have 2 swabbies on it. Why are there 2 swabbies on it?
In case you throw one of them away like me.
No. I mean, yes, but no.
One for a strep, one for a culture.
Yes. So one of them you will use for a rapid strep test. The other you will leave attached to the handle, and you'll send it for a strep culture. Okay? Because we can have a negative strep test, rapid strep test, but if we allow this to grow for 24 to 48 hours, the bacteria can grow and become positive.
So are we swabbing them twice then?
No.
No. I didn't.
So that's the nice thing about this is because they are attached, you can do both at the same time.
Oh, okay.
And then you can just transport these little guys. But I wanted you to see this piece of it just so that way you know that this is typically what we would do for culture swabbing. So wound culture, throat culture, vaginal culture, all like this, okay? So let's see what you guys remember. I did the quality controls already, so these are done from this morning. But what is, and I don't have all the pieces, what's the first thing that we want to do when we're setting up our strep test? Put our drops in the tube. So we have one of these extraction tubes. We put it into one of the open slots, and we're going to put some drops in it. What drops are we putting in?
Full.
Okay, there's
Yellow and red.
yeah, so ketchup and mustard, remember? We talked about that. You're going to put how many of each of them into your tubing?
Whatever the thing
I was gonna
says.
say
Like,
4.
this is full.
Yeah.
So, yes, whatever the package insert says. However, for our kits here, it's 4 of A, 4 of B. Okay? They go into the tube. What do I do once I have 4 and 4? Yeah, swab. So now I'm going to go to my patient. What do I need in order to swab my patient?
Tongue depressor.
A tongue depressor,
Swabby swab.
gloves, and a swabby swab. I love that that's how we're referring to things nowadays. You know what? I'm not even mad. Tongue depressor, swabby swab, gloves.
Sad thing is,
Oh, I have two. I do it for kids.
Little kids, I'm gonna use this little swabby swab.
Yep. I typically, if I have to swab them in like their nose, I tell them I'm going to clean their boogers. So it works. They know.
I'm gonna pick their nose.
Pick their nose. Yep.
When do you swallow them?
Flu and COVID.
Flu.
Oh, yeah.
Well, and SARS, RSV.
Okay.
So
RSV and annual kind of kill those. Or does it depend?
depends on the kids that you have. Yeah. So you've got these two. You've got your patient. Patient sitting or standing?
Sitting.
Are you sitting or standing?
Standing.
Why?
So you see like throat.
You can see down into their pit. What do we not want to touch when we're swabbing?
Everything.
Tongue or you
Anything but
Cheek-
their tonsils.
Cheeks, tongue, uvula, and
Teeth.
you only want to get that tonsil area. Okay?
Not the UV.
Not the
Not
hanging
candy ball.
ball.
Punching bag.
Unless you're me.
You don't have one.
Oh no, I have one. It's just not. It's not a punching bag. It looks like an upside down butt. Because I have a little slit in mine. So I actually, well, I didn't want to say what it actually looks like, but it looks like a butt. Okay. So, what do you need the patient to do?
And look
I like that nobody used their words. They just went. "Ah." Oh Lord. You have them open their mouth as wide as they can, stick out their tongue as far as they can, and they're going to tilt their head back. Not all the way back, but back enough that we can see down into the abyss. Okay? Now, what hand is holding what?
Dominant hand is holding the swab.
Okay, dominant hand's holding my swab. Non-dominant's going to have my tongue depressor. Tongue depressor, do I press just on the tip of their tongue?
No.
Where do I press?
Down deep.
Yeah, like almost the entire tongue. Why? Yeah, the natural reaction of your tongue is to protect the throat. So if you aren't holding it down and we go in with a swab, what's going to happen?
They're gonna push you out.
Yeah, they're going to push you out. Should I hold my swab here?
No.
Here?
No.
Here?
Yes.
Yeah, right at the edge. Why are we right at the edge?
You don't want your hand.
Yeah.
I don't want my hand to get in the way. Do I hold it with all of my fingers? It's very hard to do.
No.
Just your thumb.
Why?
Quick motion.
Quick motion, in and out, figure 8. What else am I doing?
Twisting it.
Rotating. Why am I rotating as I'm doing it?
Cover it all.
Completely covered.
Cover the whole thing. How long am I back in the throat area?
As quick as possible.
What's as quick as possible? Is it just like
2 rotations? Or is it 3 rotations?
10 seconds.
5 to 10 seconds, right?
Feels like so long.
I know. It seems like a lifetime. 5 to 10 seconds, in and out. Now, after, and I'm going to pull this out so that way I can just use what I've already made. Once I have my specimen, what am I going to do with it?
Upside down into the fluid.
Into my fluid, and what am I going to do with it?
Leave it for a minute.
Twist.
No.
Twist it how many times?
10.
Yep, 10 times. And then I leave it for
A minute.
1 minute. Okay, in that 1 minute, what you're going to do is then go in and open up your swab stick, get that ready, have it ready to go. After the minute, what are you going to do?
Squeeze it out.
So I pinch and pull my swab stick out between my fingers so I get off any of the excess that's on there. This goes into the garbage. And then your test strip, you're going to take, make sure that the arrow is pointing down, and drop it in. Now, the arrow, or the test strip itself has 2 spots, a C and a T. What one has to be there all together? The control line. Why?
Make sure it's working.
Yes. So, looking at these, which one is the C? The pink one? That's super helpful. They're both pink. The top one! The top one. So the line that is more towards the top, towards the blue section, that's your control line. If you have just the control line and no second line, what does that mean? What if you have a control line and a second line? Okay. What happens if you have just the test line? Can I result those?
No.
Very good. So after you put the dipstick in, how long does it sit?
5 minutes.
Very good. So 1 minute with the swab stick in there, and then 5 minutes with the dipstick in there. Okay? Everybody good? Ready? Okay. We have one more. This one is also just a discussion. And that is to administer a nebulizer treatment. Has anyone ever had to do a nebulizer treatment for themselves or for a child? So, Tiffany, you? Yeah? Anybody else?
See my grandma do
Seen, okay. So, what is the purpose of a nebulizer? What does it do? Turns liquid into a mist that we can easily breathe in, and it will open up your airways quicker. So, the tubing and everything is all one-time use only. Again, this is a pretty old machine. They don't look this crappy anymore. They're pretty cool now.
I really appreciated the one video.
I know. Is it? It's a kids one, isn't it?
Yeah, it's what is it, a penguin or
Yeah.
something?
So one end of the tubing goes into the machine. The other end of the tubing will go into this canister here on the bottom. Turn that camera up a little bit. Now, the mouthpiece goes on top. I'm sorry, that's the dual connector. Then your mouthpiece goes on one of the ends. So this is how it's actually set up, okay? What we typically have, the providers will order is albuterol. And this is albuterol 2.5 milligrams in 3 mLs, okay? So they put that order in, and then we actually just fill the machine. So they all come pre-packaged. Just open that guy up, fill in your canister. So everybody's out of the pool. And then you put your lid back on, okay? Now this is where you're going to let the patient have it. They're gonna hold it in their mouth. And just breathe normal, okay? And they're gonna do that for the full time that it takes this to run, which is typically about 10 minutes. I wanna have you hear both sounds because you're not gonna sit in the room with the patient for 10 minutes as they do this. So here's the sound when it's full. You can hear it kind of making that liquidy sound, very misty sounding. You can obviously see the mist happening, right? But you're not going to be sitting in the room, so we have to be able to hear what the difference is outside of the room. So when that 10 minutes is up, we can go in and check on the patient. How would we know after 10 minutes if the nebulizer worked and helped the patient? Okay, so maybe we do a peak flow. There's another thing that we could do before the peak flow that would give us an answer right away. Nope. What'd you say?
I was gonna say, listen to the lungs.
Not listen to their lungs.
Breathing?
Nope. Yeah! Pulse oximeter. So, 10 minutes is up. This is what it's going to sound like now. Sounds pretty empty, right? Okay. I don't take anything apart. I do that fingers pulse ox again. I check them one more time. If I check them and I see that their oxygen has gone up, I'll go tell the provider. If I see that it hasn't really changed, I'll tell the provider and they may order a second round. You all right?
I don't know.
You don't have to cry, it's okay.
No, I cough.
If they order a second round, we can use the same tubing. If they order a second round and it still doesn't help the patient, guess what they get to do?
Take one home.
Nope. They get a one-way ticket to the hospital. Okay. So that one is also just a group discussion, so go ahead and get out your skills log. That same section, you're going to see the bottom one says administering a nebulizer treatment. And you can put the results as WNL as well. It is now, I just walked away from the clock, 10:21. All right. Brenda, this is where I'm going to stop the video for content today. The email that I provide you will have all of the other information for you, so be looking forward to that.